Thank you, Madam Chair. Councilor McCarthy and I are calling for a hearing regarding the proposed 13-hospital merger of Care Group, Inc., the parent company of Beth Israel Deaconess Medical Center and Lahey Health Center. Reports have indicated that, if approved, the merger would be the largest in the history of Massachusetts. Moreover, Beth Israel and Lahey Health would control 1 in 3 hospitals in eastern Massachusetts and become the biggest health provider in the region. In a report that came out on Monday, the Department of Public Health has recommended approval of this merger, while the Health Policy Commission and Attorney General's Office have yet to weigh in on the matter. I'd like to thank Councilor McCarthy for his leadership, for his efforts, and I'm happy to work with him to raise awareness on this issue. Unfortunately, he is unable to be with us today due to travel arrangements, family commitments that had to be moved on account of the impending storm. However, Councilor McCarthy did release a statement yesterday and said, "As city councilors, it is our job to protect and give voice to our most vulnerable constituents. This merger may or may not have a negative effect on our most fragile residents. Therefore, I believe that it is necessary to hear from the experts and those impacted before any decisions are finalized." My focus on this issue stems from significant concerns that we have heard in recent years from state officials, antitrust specialists, and consumer advocates related to potential hospital mergers. At that time, public discussions centered on the impact a potential merger would have in terms of increasing market power, the ability to negotiate with insurance companies, and raising health care spending. Although this matter is under the purview of the Attorney General, the Department of Public Health, and the Health Policy Commission, I believe it is our obligation as elected officials to allow the experts and the public to weigh in and share their concerns as well. It is my hope that this hearing will allow us to learn more about whether this merger would impact other hospitals, as well as local community health centers in the city of Boston. Perhaps this hearing will help us to understand what effect, if any, this merger would have on access to health care for middle and low-income residents, communities of color, our immigrant community, the elderly, the poor, the disabled, and our most vulnerable. Thank you, Madam Chair.